Hello, my name is Wade Green and I'm the Director of Athletic Training Services and Athletic Healthcare Administrator at Hardin-Simmons University in Abilene, Texas. The following presentation is for student athletes and families. It's been prepared to provide a basic level of education on concussion while utilizing current evidence. More importantly, a specific portion of this presentation is devoted to educating student athletes and families on the importance of reporting symptoms of a possible concussion so that it can be properly evaluated by a trained medical professional who is experienced in concussion management, specifically an athletic trainer or physician. You'll notice a page within the Sports Medicine Summer paperwork that requires you to acknowledge that you've completed this educational video, understand its content, and that you will play an active role in protecting yourself and your teammates if concussion symptoms are present or if a concussion is suspected. The content contained in this presentation is to be utilized for educational purposes only and not for definitive diagnosis and management. This presentation represents educational content for the purpose of fulfilling institutional NCAA requirements. This information is presented to you in good faith as an attempt to educate, warn, and facilitate healthy behaviors. Questions regarding diagnosis, management, and return to play are based on individual factors and personal medical history. Please direct questions regarding individual diagnosis and management decisions to your athletic trainer or physician. There's no shortage of information to search for when gathering information about sport-related concussion. Google, WebMD, and others are common sources of information. Will Smith even starred in a movie titled Concussion. Unfortunately, much of the information in these sources is less than accurate. We need to draw our information from the appropriate sources. As such, the 2016 Berlin Consensus Statement, Inter-Association Recommendations from the NCAA Sports Science Institute, the National Athletic Trainers Association Position Statement on Management of Sport-Related Concussion, and current literature regarding concussion reporting and return to play will be used for this presentation. Having information that is based on the best available evidence is vital. The Consensus Statement on Concussion in Sport was developed by the Concussion in Sport Group in October 2016 during the 5th International Conference on Concussion in Sport held in Berlin, Germany. A panel of experts on concussion were brought together from all over the world, including sports medicine physicians, athletic trainers, neurologists, neuropsychologists, and other health professionals. A list of 12 key questions were developed to guide the development of the Berlin Consensus Statement. This represents the gold standard for how medical professionals diagnose and manage sport-related concussion. The NCAA joined a group of associations to make recommendations specific to member schools and their student athletes. This resulted in an inter-association consensus statement on diagnosis and management of sport-related concussion best practices. 15 different medical organizations gave their endorsement to this statement. The National Athletic Trainers Association, or NATA, is included in those organizations, and an experienced team of both athletic trainer and physician concussion researchers have been at the forefront of drafting best practice recommendations since 2004. Hardin-Simmons University is an NCAA member institution, so it's important to consider what the NCAA has to say on the topic of concussion. The NCAA Sports Science Institute aims to provide college athletes with the best environment for safety, excellence, and wellness through research, education, best practices, and collaboration with member schools, national governing bodies, key medical and youth sports organizations, and the public and private sectors. As NCAA student athletes, your level of knowledge on concussion and your ability to recognize it, talk about it, and report it are tied in part to what you know. That is where our discussion begins. As student athletes who have played competitively in high school, all of you are aware of concussion to some degree and may know less about how concussion is managed. The intent of a concussion management plan is to keep student athletes safe by removing a student athlete from play when a concussion is suspected and providing a comprehensive plan for managing that concussion from initial identification all the way through full medical clearance to return to play. When an athletic trainer or physician hold a student athlete from play when a concussion is suspected, it isn't simply an inconvenience. It may save your life. Attempting to play with a suspected concussion can lead to second impact syndrome, or more serious neurological complications if not reported or hidden. A second impact syndrome can lead to permanent disability, paralysis, or death. what you know and how you act before a concussion occurs may directly affect your ability to recover from it. Sport-related concussion is a traumatic brain injury induced by biomechanical forces. Simply stated, concussion is a brain injury. It can be caused by a blow to the head, face, or body by another person or object that causes the brain to strike the wall of the skull. It isn't a ding, getting your bell rung, or clearing the cobwebs. These terms are simply wrong. A concussion is an injury that results in changes in neurological function that are not permanent. But this doesn't mean that they shouldn't be taken seriously. Those changes can cause many different types of symptoms, but those symptoms resolve after a period of time. It's commonly accepted that when a concussion happens, injury to the brain happens at a cellular level. This injury is thought to result in the tearing of nerve cells or axons that send messages throughout the nervous system. Additionally, chemicals are released from cells in large amounts, which creates changes in how the brain uses the energy it needs to function, and can cause hypersensitive reactions to normal everyday sensations like sight, sound, and pain. This is often experienced during a concussion as light sensitivity, noise sensitivity, headache, or migraine. If you've ever seen images of an MRI or CT, you know that these things typically provide views of specific anatomical structures throughout the body. These types of imaging studies do not allow for visualization at a microscopic level. Since concussive injuries typically happen at a cellular level, standard imaging techniques such as MRI or CT are negative and do not show structural changes. An objective examination usually determines the need for imaging studies to exclude emergent pathology. One common misconception is that the right helmet or piece of headgear will prevent concussion. To date, there's not been a helmet or piece of protective headgear that has been shown to prevent concussion. Laboratory studies provide a good illustration of how a blow to the head causes strain on brain tissue. Impacts to different locations on the helmet caused the brain to quickly accelerate in both a straight line and at an angle inside of the skull, with a large and varied amount of stress. The point is that the stretching and deformation of brain tissue is what is currently understood to be the cause of concussion symptoms. Also, the magnitude and location of a blow to the helmet has not been shown to correspond to the type of symptoms or whether or not someone sustains a concussion. This means that helmets currently play no clear role in prevention of concussion, since current science cannot establish a relationship between impact location, magnitude of impact, presence of concussion, and how concussion affects an individual. Additionally, warning labels located on some helmets clearly state that helmets do not prevent concussion. But what about headgear in soccer? Headgear in soccer was not shown to prevent decreases in cognitive testing scores after repeated heading, and those players with headgear were shown to have greater acceleration of the head when wearing headgear. Also, in the case of soccer headgear, no protective benefit has been shown against concussion. The Concussion in Sport Group has developed such tools as the SCAT-5 to assess concussion symptoms, and there are currently 22 possible symptoms of concussion. Those symptoms typically fall into clinical domains such as somatic or physical symptoms, balance impairment, behavioral changes, cognitive impairment, and sleep-wake disturbances. Each symptom is scored on a scale of 0 to 6 for a maximum possible severity score of 132. It's important to note that not all of these symptoms need to be present for a concussion to be diagnosed. As few as one of these symptoms to many more can be present. One major reason cited for not reporting symptoms of a possible concussion is that some student athletes did not think that the symptoms are serious enough. Any of the symptoms here that are being experienced after a blow to the head or body needs to be reported to an athletic trainer or physician for further evaluation. A growing amount of evidence is demonstrating that concussion can have effects on overall injury risk, quality of life, and possibly even your performance on the field or court. Student athletes who have sustained concussion have been found to have 1 to 2 times greater risk for musculoskeletal injury within a year after sustaining a concussion. Interestingly, batting performance in baseball players with concussion declined after concussion. NFL skill position players were found to give up more yards per game prior to appearing on an injury report for having sustained a concussion. But it's not clear that concussion was the contributing factor to that loss of performance. An important point is that the authors of that study were concerned that non-reporting of concussion symptoms may have been the reason for that finding. Lastly, we turn to quality of life. There are 2 studies conducted by athletic trainers that have looked at how a history of concussion affects someone's quality of life physically and psychologically. A 2010 study reported that those with a history of multiple concussions experienced greater amounts of bodily pain in daily life, lower amounts of social interaction and satisfaction, and decreased vitality. A recent study in 2018 studied former collegiate football players who played NCAA football from 2000 to 2001 and followed them for 15 years. Those with a history of multiple concussions on average reported physical health lower than the national average, lower than average measures of mental health, and a 2-fold increase in depression. It's important to note that these long-term effects do not apply to everyone that sustains a concussion. As previously noted, concussion affects everyone differently, and individual decisions about diagnosis, management, and long-term health should be discussed with a medical professional with experience in concussion management. So how exactly does Hardin-Simmons manage concussion? We'll take a brief overview of the concussion management program at HSU. Baseline testing is a mainstay of concussion management. It gives us insight into a student athlete's medical history, physical characteristics such as balance and symptoms, and neurological testing such as the impact test. This information is important for diagnosis and management decisions. When a concussion is suspected or if symptoms are reported after an impact, a student athlete will be removed from practice or competition. They will be evaluated by an athletic trainer or physician, and if there is concern for concussion, that student athlete will not return to play that day. The student athlete will be evaluated further with appropriate action taken. Instructions for care at home will be made available to the student athlete. Additionally, your professors will be notified of the injury and requests will be made for accommodations in the classroom as needed. Once a student athlete has been symptom-free for 24 hours or more, they will undergo repeat neurocognitive testing. If that testing is within baseline ranges, the student athlete will begin the return to play protocol. It is also possible that repeat testing may be conducted prior to the full contact phase of the progression at the discretion of the team physician. The return to play progression is a 5-day process. Formal activity restrictions exist for the first 3 days of the progression, with monitored full contact allowed during the 4th and 5th final day. The first day begins with light aerobic exercise and progresses to more demanding aerobic exercise and calisthenics on the 2nd day. The 3rd day consists of weightlifting and sport-specific non-contact drills. The 4th and 5th days are full contact practice, followed by gameplay. As athletic trainers who have spent considerable amounts of time around NCAA athletes, we understand the desire and commitment that student athletes put into their respective sport. However, reporting a concussion isn't just an inconvenience. It's actually a protective measure to help you remain active in your sport for a longer period of time and be at your best. Recent research examined missed time by collegiate athletes who were immediately removed from activity after concussion. Those athletes who were immediately removed from practice or competition after sustaining a concussion missed on average 3 days less of practice and competition than those who reported their symptoms later. It's true that reporting symptoms of a concussion will lead to examination and possible removal from practice or a game, but you play an active role in your health by reporting those symptoms. More importantly, you are most likely saving yourself from worse post-concussive symptoms than a teammate who chooses not to report their injury. It is also worth noting that these athletes in this study who were immediately removed reported fewer number and severity of symptoms after their concussion happened. Reporting symptoms is always a good choice, never a bad one. What are all these circles for? This is a behavioral model known as a socio-ecologic framework. It's a big word, but this provides a layout of situations or different levels of pressure or resistance that you might encounter when considering whether or not to report possible concussion. You are the center of this model. At the interpersonal level, you may be confronted with comments or expectations from teammates or coaches or family members to continue play. The cultural level may represent things like a team culture of denial around concussions, calling concussions the C word, or pressure to be tough at all costs. An important point is that being tough at the wrong time could actually affect your ability to exercise real toughness at your peak for the rest of your career. Know the difference. Team rules or expectations represent the policy level of this framework. Team rules shouldn't ever and rarely do conflict with your health, but if they do, let your athletic trainer be the guide to help you navigate that. You have to remain in control and report your symptoms. Don't give in to pressure to do the opposite and hide your symptoms. HSU Sports Medicine sincerely appreciates the time that you have spent completing this vital educational requirement. We look forward to seeing you in the fall. Please follow the link below to take a required quiz.